Hi, everybody. I'm Bruce DuPoit. Coming up today on News Talk, are you an allergy sufferer? If so, spring is almost certainly a challenging time of year for you. Dr. Nsouli will have the latest treatment options and advice.
From News Channel 8, this is News Talk with Bruce DuPoit.
And we are so delighted to welcome you in on this Wednesday. We've got a great lineup for you this time. Thanks for making us a part of your day. If you are an allergy sufferer, the arrival of spring can be a mixed blessing. You love the warmer temperatures and the greenery and the longer days, but the itching nose, sneezing, and watery eyes can make life unpleasant. Fortunately, the doctor is in. Dr. Nsouli is with the Watergate and Burke Allergy Center. He joins us now. Welcome back. Good to see you.
Thank you for inviting me.
Always great having you here. I'm sure your phone rings off the hook when spring arrives. Is every spring pretty much the same, or does it vary from year to year? And if that's the case, what has 2016 been like?
2016, we have been seeing suddenly within the last 2 weeks a significant increase in pollen. So we have been having the juniper pollen, elm, and maple pollen. These are the trees that are blooming and causing a lot of problems. And this is affecting tremendously patients with hay fever. They get stuffy nose, runny nose, sneezing, their nose is blocked. They get itchy eyes, watery eyes, red eyes as well. And also we have the patient with asthma. Important to know that asthma, I think, greater deal of individuals who have asthma do not know that asthma is mainly an allergic disease of the lungs, that allergies cause asthma. And these patients start to have allergy symptoms in the lungs that results in wheezing, cough, difficulty breathing, shortness of breath. So I think it's very important for the viewers to know not to wait too long for them to be treated. We like to have medication on board to block the allergy receptors about 2 to 3 weeks before the pollen season, before the allergy season. And we see it often when patients come to see us late. The treatment is much more difficult because already the allergy mediators are out, their symptoms are out. So early treatment, very important, not to wait too long, since we know that, for example, last year they had some problem with the trees. Have your treatment to start early.
Jumping on your allergies when you first feel the symptoms can help, it sounds like, shorten and reduce?
And more effective, absolutely.
More effective?
So even before noticing the symptoms, if we know that during the tree season we have some problem, maybe at the end of February, March, beginning of March, to start to take the medication. About 2 to 3 weeks prior to the allergy season, studies showed that we block and we prevent these exaggeration of allergy symptoms, and then the treatment will be more effective and patient will enjoy their spring.
We have 2 segments with Dr. Nsouli, and we want to give you an opportunity to ask a question or get some advice from him. He's with us several times a year, typically spring and fall being, it would seem to me, chief times when people like us are suffering from allergies. So phone lines open, number at the bottom of the screen, dial now. It increases the chances we'll get to your call and your question. 703-387-1020 is the number here. We're able to take calls in the 11 a.m. hour. So if you're watching between 11 and 12, dial in. We will go to the phones as your questions and comments come in. The things that we see advertised on TV tend not to distinguish between the cause, the source of the pollen. Are your treatments predicated on what the individual person seems most allergic to?
Yeah, absolutely. I think one of the most important steps in treating allergies is finding out to what the patient is allergic to. So we do an allergy skin testing that within 10 minutes we'll be able to find out the nature of the allergens. Number 2, we'll find out the severity of the allergy that the patient has. And once we get the history along with that, we'll be able to tailor an appropriate treatment for the patient to get better. So it's important we have an individualized treatment for every patient depending on their symptoms, depending on their allergens, depending on the severity of their allergic reactions, and this will allow the patient to have good quality of life.
Give us a feel. You've brought show and tell, and we always welcome your show and tell.
Sure.
Give us a feel for what's in the arsenal and how you approach getting people the relief that they're craving.
Absolutely. I think this is a model that I always like to use it. So this is the nasal cavity. If you look at it clearly, and the nose is a tunnel where we do have a variety of things that do happen. We notice on this side that we do have the allergy nose with swelling of the lining. We have mucus secretion. This is the tip of the nose in here. And this is the normal nose. So when we have allergies, the inflammation and the blockage can block the sinuses. What's the sinus? It's a tiny pocket. We have 8 pairs of these pockets, the frontal sinuses, we have the sphenoidal sinuses, the maxillary ones, and the ethmoidal ones. And these sinuses are connected, all of them, with the nasal cavity. When the nasal cavity gets congested, and we have increase in mucus, they cause the sinuses to act up and we get sinus infection. So often patients tell me, Dr. Nsouli, I don't have allergies. I get recurrent sinus infection. You are an immunologist, check my immune system. I tell them, hold on 1 second. Before going on immunology, let me check your allergies. And often these patients are allergic. We treat their allergies, we prevent sinus infection, we prevent them from using antibiotics after antibiotics after antibiotics that are known to be harmful if we use it all the time.
So it's not just the nuisance factor, if you will, the discomfort, the itching, and all the things that we hate about allergies. If it gets to the infection level, we've got double. It's sort of like double the problem.
Exactly. We call it the morbidity as well. And in addition to that, we know that we have some systemic problems that can occur. We show that allergies left untreated can lead to fatigue, tiredness, lack of energy. So we did a study that we published a couple of years ago. We showed 80% of the patients that have allergies have fatigue, lack of energy, and we treated their allergies, 70% of them get better.
And just as the days are getting longer and we're theoretically out and enjoying life more, you're feeling sluggish and all you want to do is sit in the chair.
Very important.
Calls coming in now. Let's begin with line 1. Hello, Laura in Woodbridge. You're on the air. Go ahead, please.
Yes, hello. It's a pleasure to talk to you, doctor.
Yes.
Thank you for calling in. Your question?
My question is, I've been suffering from allergies for a while, and now it turns into asthma. I have asthma for quite a few years now. And I've been taking nasal sprays. The last time I went to check to the doctor, which is 2 weeks ago, he told me that I have a lot of allergies in my nose. So he prescribed a nasal spray day and night. And also I take Singular and I take Zyrtec. Now my question to you is, should I keep taking these medications? There is other way that I can help myself so my chest doesn't start wheezing, because I do get a lot of fatigue and I do get a lot of discomfort in my body, and I don't feel much energy.
Yeah, sure. We all sympathize.
Absolutely. So Laura, I think, is illustrating the study that we did, that allergies can lead to fatigue and lack of energy. So important to know, we're talking about fatigue, Laura. That's a good question. Laura, you have to be aware that Zyrtec is a good antihistamine but can cause some sedation. So I will not go on the Zyrtec. I will use a non-sedating one, such as Allegra, fexofenadine, or the Claritin, desloratadine, or Clarinex. These are non-sedating ones, and they are over the counter. You can have them, number one. Number two, talking about the nasal allergy and the lung allergy, asthma. So the Zyrtec, your nasal spray, is fantastic. Use it because the nose is a filter for the lungs. I always tell my patients we have to have a clear nose in order to breathe well. However, to treat asthma, we have to use the appropriate medication in the lungs. We have to have the appropriate inhalers. We have the anti-inflammatory inhaler medication that we use. We have the bronchodilators as well. So we have to add, I think, to Laura's treatment and a appropriate treatment that will get to the lungs and to clear the lungs and prevent her asthma attacks.
And good to have a conversation with your doctor about what to expect in terms of a drowsy impact of the medication so that you can plan driving or other things.
Absolutely. So it's very important to mention to your doctor that you have also with your allergies some fatigue and some tiredness, and to get the non-sedating antihistamine that are very effective and very safe.
Dr. Nsouli, stand by for just a moment. We're going to take a break here. Most of you will see much more of our conversation with and our phone calls for Dr. Talal Nsouli. Of course, you can always watch News Talk videos online on our blog. It's news8newstalk.com. We're back in just a moment. Welcome back to News Talk and our conversation this time with allergy expert Dr. Talal Nsouli. We will go back to the phones. We'll open up the phone lines again for your allergy questions for Dr. Nsouli. If you're watching us leading into the noon hour, we're live. We can take your calls, answer your questions on TV, just as we did for Laura. So grab an open line at our number, 703-387-1020. Several more minutes. for you to talk directly with Dr. Nsouli about whatever your allergy question is. Do you want to talk about whatever sort of new treatments, whatever new tools in the toolbox you have at this time?
So we have a major breakthrough, I think, in the field of allergy and asthma is these new medications. And these are medications for patients with moderate to severe allergic asthma. So the Nucala has been approved now for several months, and it's giving once a month and works very well. So in essence, what it does, and today, just now, about 3 hours ago, the FDA approved Syncare, which is Resluzumab, a special medication similar to this one. And what they do, they decrease the IL-5. IL-5 is the gasoline for the allergy cells that cause asthma. So it's given once a month and works very, very well. So this is a major breakthrough for people that do have severe asthma, that are not responding well to the medications, and that are having exacerbation. So very important to know about Nucala. The other important thing that I would like also to mention is the breakthrough in terms of testing. People that have food allergy, peanut allergy, tree nuts allergy, milk allergy, egg allergy.
So common all of a sudden.
People get confused, they do not know what to do. The testing is still open to debate. So there's a new test that came called the component testing. So we take the peanut and we check all the components of the peanut in terms of analysis, very advanced analysis. And even though we are allergic to the main component of the peanut, we could be able to eat it if one portion of the peanut that we are allergic to is not the aggressive one. For example, if we do a testing and we found out that the ARA-H2, which is one small component of the peanut, is the one that I'm allergic to, I should not touch the peanut. Likewise, for also milk, if we find out that the patient has a component called BOS D8 in the milk, it means the patient should not drink this milk. However, if the patient has a positive allergy reaction to milk and doesn't have the BOS D8, can eat cheese, can drink milk, especially if they are cooked. So it's important to remember, if we have food allergy, ask your doctor for the component testing. The breakdown of these foods will help tremendously our patients for them to avoid malnutrition. Often we see patients coming, they are avoiding 6 or 7 different foods, they are losing weight, and this is totally unnecessary and can affect also the immune system.
There was a study that a lot of people had interest in, and it was to ward off a peanut allergy. I will give my child exposure. I will give my kid peanut butter at a very young age.
Absolutely.
Do we know enough to be able to say with certainty that this is wise?
Bruce, this is a very important question that you're asking, and in response to the question, a study came out. In the past, we used to tell our patients and the kids to prevent peanut allergy and nuts, avoid all nuts and tree nuts, including peanut, for the first 3 years. A study that came out, a breakthrough study called the LEAP study, and this is a study on peanut product. So what they did in this study, they took about 600 patients, and they divided half of them. Half of them, they were 4 months of age, 4 to 6 months of age. Half of them received peanut at 4 months of age, and half of them did not receive peanut for about 5 years. After 5 years, what they found out, that patients, children that received the peanut 3 times a week had 80% less peanut allergy than the infants that were not fed peanut at all. So it appears that we have to change our thinking. Early exposure to some of these foods can help the immune system to start to build up an immunity to them and to fight against them. However, we have to take it with a grain of salt, because this study, there was no placebo control then when this was done.
Sounds like this is worth watching, but more data would be really nice.
Yes, sir, absolutely.
We have about 90 seconds left, just long enough for us to talk with Vivian. She's on line 1. Hello, Vivian. Jump right in with your question if you would, please.
Hello.
Hi, Vivian.
Hi, Vivian.
How are you?
Good.
Hi,
We're really good.
Okay. I wanted to know, is this 1 or 2 doctors have told me in the past I could take baby shampoo and rub around my eye, especially on the eyelids of the hair, and keep my eyes from running water and burning and everything because the pollen can't stick to it. And I want to know what's that.
We have about
Do
40
you agree with that?
We have about 40 seconds. Doctor.
Vivian, a good question. However, using baby shampoo, we are patching the problem only. It's patching the problem. We would like to find out to what you're allergic to, Vivian, to tell you what to avoid. For example, you're allergic to trees, close the windows in your bedroom, close the windows in the car. And number two, to have the appropriate treatment. So we do have eye drops that you can buy over the counter, very inexpensive. They used to be prescription for $200. Now they are $9 and $10 over the counter, such as Zaditor. Buy the Zaditor eye drops and use it in the eyes. It's an anti-allergy medication, safe and effective. Use it 2 to 3 times a day, and your eyes will feel much better.
Dr. Talal Nsouli of the Watergate and Burke Allergy Center, always great having you here. Thank you very much for your time. I know we'll be talking with you again in the weeks and months that follow. Thanks again.
Thank you.